My name is Tana Setness Hoefs, and I am a provider in the OBGYN department at Ultra Health System. Pregnant women inherently are at higher risk of getting COVID infection because of certain physiologic changes that happen in pregnancy. And because of those changes, it makes them more likely to get the infection, to get sicker when they get it, have a higher risk of needing to be hospitalized. And we know that all severe infections in pregnancy, no matter their cause, can have negative impacts on the outcome of pregnancy. So because of the predisposition to getting sicker in the first place, it just makes it that much more important that pregnant women consider getting vaccinated, even if they consider themselves totally healthy and at a young age. So we know that there are well over 30,000 women who have received the COVID vaccine in pregnancy. There is a vaccine safety monitoring program through the CDC that many of those women are enrolled in. Over 300 of those babies of the women enrolled have already delivered, and we are not seeing any increased risk of adverse outcomes in women who are vaccinated versus their counterparts who were not. All young people tend to have a more rigorous response to vaccines in general, called reactogenicity. So more likely to run some low-grade fevers, to have tenderness at the site that the vaccine is administered. Compared to older people, our immune systems just are a little bit more revved up, but we don't see pregnant women reacting any differently to the vaccine than their age-related non-pregnant counterparts. So there are ongoing trials looking at that right now, but there are case reports coming out that are very optimistic. We've seen babies born with antibodies only 3 weeks after the mother received her first dose. So the mother wouldn't even be considered fully vaccinated yet, but baby has some protection. And just in the last 2 weeks, we've seen the first case report of an infant whose mother was vaccinated after it was born that has now developed antibodies because its mother is breastfeeding it. Absolutely. There's no difference for breastfeeding versus pregnant versus not pregnant, and the fact that we now know that some of this immunity has been transferred. I certainly would recommend that a mom who maybe was hesitant to get the vaccine during pregnancy get it as soon after delivery to hopefully get protection to baby through the breast milk. Talk to your healthcare provider. Talk to someone who knows the science, that cares for you, that cares for the outcome of your pregnancy, and trust the people that know what they're talking about. We do see vaccine hesitancy in all types of patients. We do particularly hear in young patients, oh, I'm young, I'm healthy, it's not gonna hurt me, why should I get this? You know, COVID is 10 times deadlier than the common flu. And fortunately, in young, healthy people, that doesn't happen very often. But one of the most difficult things about this virus has been our inability to predict who it affects bad. You know, we've all heard of the 90-year-old patient in the nursing home who got it and made a full recovery. And unfortunately, we also know in this community of young, vibrant people that had or should have had a lot of life left that we've lost because of this virus. I think the fact that a lot of patients or people are thinking about the vaccine and getting the vaccine only in regard to what effect it might have for them. And I guess if anything, I would try and encourage people that consider themselves young and healthy and at low risk of having a complication from the virus to consider getting it to hopefully prevent them from passing the virus to someone who is going to be more vulnerable.